heading off to a Hmong tribe way up here in the mountains in the Mai Chau Highlands. And this is the third year we've come together with Buffalo Tours to this particular village. And in this village we'll be doing health clinics. We'll also be doing a fluoride varnish treatment on children's teeth. And we'll be doing a health education component. We've got a group from the Seattle Community Colleges, which is downtown Seattle, Washington. And we organized some programs about 5 years ago. We call them Global Impact. And it's a program that combines our students and faculty from the Seattle Community Colleges with community members and a lot of Seattle area healthcare professionals. What we do is we go into developing countries and we do medical clinics, we do health education, and we do what we call infrastructure development projects. So we're delighted to be here in Vietnam this year. This is our third year in Vietnam, working with Buffalo Tours.
The entire group is about 28 people, and we are looking after some of the hill tribes who have very poor access to even basic healthcare. So even if they have high blood pressure or diabetes or other basic conditions, they may go undiagnosed. So over the next few days, we're going to be running a few clinics, treating about 250 patients a day. I'm a surgeon by background, but I'm also an eye surgeon, and so I'll be doing the ophthalmology, looking at eye disease. We've ascended into the hills of Mai Chau, and we're waiting with anticipation to see what it's like when we get into the villages. Our first stop was the village of Hang Kia, where the Hmong people live. The total inhabitants equal about 900. So we've just arrived at the school where we'll be doing the clinic. It's about 8 o'clock at night, it's dark outside, and we're just setting up the clinic for the next day. So everyone's unpacking all the medical supplies, the medicines, the fluoride, all the things that we brought with us, so that we're ready to start early tomorrow morning for a long 12-hour day of treatment. Okay, so here we are at day one. Bright sunshine, it's going to be a hot day. Yep, so here we are at the clinic, we've set up. It's a rather bizarre sensation being here in the middle of the foothills of Vietnam, doing a clinic, waiting for all the patients to arrive. Of the odd things that I've done in my time, this ranks pretty highly. It's a bizarre experience, but hopefully we'll be helping the local community. So we're all ready and raring to go.
This is a little 4-year-old boy whose name is Dan, and he's got an abscess on his bottom, and the abscess has been there for 2 days, and it looks like we've got the top off of it and the infection is starting to come out, and we're going to go ahead and give him some antibiotics, and he'll be just fine in a matter of days. He's got a lot of swelling, and as you can hear, it's painful, but he'll be over it quickly.
That's difficult doing that with no anesthetic. That's something that would certainly not be done without some sort of pain medication or numbing. You know, so it's hard for me to do that, to hold a child down when I know they're in so much pain. It was difficult, but it's going to get better.
These are school children. They've just been sent over for a well child check. So we're just kind of looking for problems while they have the opportunity to be seen.
Clinic's going well. We've had a lot of volume of patients come through already, and I've treated a range of conditions from helminth worm infections to significant cardiac pathology, iron deficiency anemia and gastritis. So we've had a real range of problems. It's actually quite exciting. The overarching feeling is that we're doing some good, but I'm also thinking at the same time, how do we make this sustainable? How do we make sure that once we're gone, these people will come back and get the necessary treatment? Because it's not just about one-off hits, it's about sustaining the treatment. We have all the local doctors with us, and we're training them up. So they're learning something from us, but there is something lost in translation. Our translators are doing a great job, but it's difficult to get the message through in the hectic circumstances when there are so many people around. And with the influx of all the kids, it became a bit of a madhouse, as suddenly there were hundreds of people milling around waiting to be seen.
It's gotten busier and busier. We have 4 doctors working inside, and we have 30 school children coming from one classroom. So we had to move 2 of the doctors outside, and they are seeing children doing general exams. After the children have their height, weight, and arm circumference measured, they come out in groups of 6 and sit and wait to see the doctor. So we have a Vietnamese doctor and 2 American doctors doing general well-child checkups on the children. And then they get their multivitamins in the pharmacy, and then they go back to their classroom. So it's going fairly smoothly.
Well, both of the kids have got nasty infected scalps. It's a form of NIT. It's probably something called tinea capitis. So the mainstay of treating this is hygiene, and it's gone between the 2 kids. It's also switched from just the scalp onto the body, and there are lesions all over the body. So the aim of the game is to get this as clean as possible with an alcohol solution. It's going to burn the kids, but it'll help get rid of the organism. And then we need to give some medications to treat the underlying organism as well. But the biggest thing is to keep the family as hygienic as possible. It's a bit like scabies. It'll come back and back unless there's good hygiene in the family. So the lesson here is about health education, not just a one-off treatment. So I'm going to make sure that happens.
Very, very young parents. This is the mother.
Both of them were malnourished. The 18-month-old looked like he was probably 6 months old, and it hadn't reached his growth quartiles. So the lesson there is you can treat the infections, but it's going to keep on happening unless you educate the parents. So what we did was send them off with an interpreter to sit down for 20 minutes or half an hour to explain what basic hygiene's about and basic nutrition, so that the kids can try and catch up with their maturity as they should, and stop getting these recurrent infections. It's very distressing for the children, and actually very distressing for us when we see such a nasty infection and malnourished kids like that.
The people, they don't know the importance of healthcare system. I mean, when they have some disease or something like that, they just, invite over some a man in the village who can know how to collect some sort of herb to cure disease and something like that. Or even some story I heard, they just invite over the sorcerer to do some sort of ceremony. And after ceremony, they think that the disease will be gone or something like that.
A very busy day. We've seen over 400 people altogether, which meant that all of the doctors and the other staff are very busy. This afternoon saw a minor operation being done. It saw all sorts of conditions, but quite a few well children check, just to make sure that they're developing okay. We measure their arm diameters and their heights, and generally speaking, compared to the Western world, they tend to be a little bit smaller. But there are some that are suffering helminth infections and malnutrition, for which multivitamins and anti-helminth medications make a huge amount of difference. It's just one tablet for helminth treatment, and it stops them from being anemic and malnourished and allows them to grow properly. It's quite important. So we've done some really good work here, and we've got a nice evening now. The sun's coming down. People are packing up shop before we move on for the next day, where we trek for about 7 hours to get to the next village, where we'll be setting up for 2 days, and we'll have quite a high volume over there as well. Yes, day 2, or maybe day 3 even. We lose track out here. We're just setting off for our big trek today, and we're trekking off to the next village. Now, I hear this village is considerably lower down in the valley, so hot, even hotter than here, so it's going to be fun, but we're looking forward to a good walk. After a long, grueling day, we arrive in the village of Bao La.
This village is home to the white Thai people. Altogether, the population in this village is about 1,000 people. And lots of these people, they are farmers, and they are, because of the remote area, they don't have lots of chances to see the doctors in their life. Yeah, so this is a great opportunity for them to be seen by the doctors.
It's now 7:30 and we're just off to go and start the clinic, so we're rushing off to do that. But we're looking forward to a busy day ahead.
We have people waiting. It looks like hundreds waiting behind this gate. They come through one at a time and they're registered at this table. So it's chaos right now. But we're seeing patients. I think we're getting it done.
As you can see, we have a big crowd today and very busy, and still outside lots of people keep coming and coming. They all come from this community because all around this there's about 1,000 people, and all they come today and looking for us to be seen for today. Because as we see, lots of these people, probably they never seen a doctor before in their life. Sometimes they have some disease and they don't have any chances to see a doctor. So this is a great time for them to be seen by the doctors.
We've got an example of where we can do a little bit of treatment, but the problem is in sustainability. This lady's come in complaining of a swollen and painful knee, and she indeed does have a very swollen knee. If she was in the Western world, then I'd take her for an arthroscopy, probably repair the ligament, and offer her a much better quality of life. But the access to that is very poor. So it's a bit disappointing in that all that I can do is give her some anti-inflammatories and suggest that she rests it, because we know she's not going to rest it. The anti-inflammatory she may not take after a few days, and this knee is probably going to get worse and worse until she can't work anymore, which then decreases her productivity. But it's one of the frustrations of the clinic. That's the way it goes. We'll do our best though. It's getting warm in here. I mean, we're sitting at about 34, 35, and it's humid with a poultry fan blowing above. And when you're seeing this volume of people and translating, it's quite horrible. But, there we go. Right. Actually, it's funny because there's a lot of very similar complaints. Finger tingling, knee pain, a lot of muscular complaints. And actually, the majority of people that I'm seeing are women. It seems to me that perhaps the women are toiling out in the fields a lot more than the men, because they're the ones that are coming in with the lower back pain, the shoulder pain. We've seen them out in the fields carrying these big, heavy bags full of wood for the fires and out in the paddy fields and things. So I'm seeing a lot more women suffering than I am men. It's difficult. I mean, the main idea here is to exclude any serious pathology, to make sure there aren't any cancers or other things going on that would need immediate treatment. If it's musculoskeletal, try and give them advice about exercising, limbering up in the morning before they work, and giving some anti-inflammatory medications. Actually, what it does do is it breaks the cycle of pain. So even if you give a short, sharp dose of 2 weeks of anti-inflammatories, if they take it, then they find that they are much more liable to movement, and it breaks that. They can become a cycle of pain. So it is useful for that at least. Okay, let's have a look at you. When someone's only got one eye left, do you do a cataract operation on them, or do you not? Because the risk of an infection or something, if they lose their only eye, it'll in this country it'll kill them, because they'll be totally blind and completely debilitated. But she's a frail old elderly lady, and when cataract surgery goes wrong, it's the most debilitating thing. So my recommendation is that even though her vision is quite poor, she's got a good functional level of vision, she's getting around, she's obviously operating independently. And here you've got to treat the patient and not the disease. The disease is the cataract, the patient is actually doing all right. She knows what's wrong with her, I've explained it to her, and if it gets worse then she can have the operation at that stage. By having the cataract there, it's not actually going to damage the eye any further. It's just a matter of getting it out of the way when it gets too much. Both eyes or left eye? Yep, so we've finished for the day. We've had lots of interesting pathology. Some delights, some frustrations. There's so many differentials in here. It's whether the patient feels incentivized to go and see the hospital, whether even if they go and see the hospital has the technology and the ability to diagnose what we think is wrong. When the patient gets conflicting advice from the hospital and from us, they're going to lack confidence and probably ignore their symptoms. The medications that we give them, sometimes are we over-treating them? I mean, all medications have side effects, even vitamins. We don't want to overdose people who aren't used to Western medicines with Western medicines. So there are lots of things that run through my head as to, does this work, doesn't it work? if I were to be asked the question, is this a good thing or an unnecessary thing, I would definitely say this is a good thing. We are bringing good interventions to these people, and I think psychologically it gives them a lot of reassurance to at least be able to see a doctor. A lot of them have come back from last year and said, I felt much better after seeing the doctor. So even if it's only psychological treatment, then we're doing good. But I do think that in the 4 or 5 cases that we picked up today that have been serious disease, hypothyroidism, breast cancer, blindness, these things, those are the things where we've really, if we can pick those up, we've made a huge difference, and it's worth it just for that.
One program we're doing now, I would not mention about how much many people we treat, how much medicine we given, how much money we spend on this program is probably not relevant. What do relevant is, I think a lot of people would probably feel better. That 1,500 people would probably feel better about what we have done to them. That they've got a chance to see a doctor in their life. That many of them may not have had the chance. The fact that having someone else to come and care would really make a difference. And it makes difference not because of the actual thing that we care for them, but the whole intentions would make and would move people. Tell a story. Actually, Dr. Chuck Morrison told to us on the 3rd day. He told a story that he left before he left the U.S. to Vietnam for this program. He was meeting with one of the Vietnamese doctor. He will stop him on the way and say, Chuck, I want to tell you something. What you're going to do in Vietnam would make me become a doctor. When he was very young, he was Vietnamese and he was living in Cambodia. He was very sick. He didn't know what his problem. And there were a group of doctors who came to this remote area and do the primary care. And his mother took him to that clinic. And the doctors gave him some sort of cream. And after I applied the cream on him, he felt so good about it. And he was so grateful to the doctor. And all his life he wanted to become a doctor.
And he says that he remembers that single event. Nothing dramatic. That single event is something that made him decide to be a doctor. And he says there's no question this was a life-changing event for him because he always goes back to that point. Nothing dramatic, Just.
That's a great story. It's nice to hear that.
Yeah.
So basically, a mission like this some years ago convinced him to become a doctor.
I think that's a problem that a lot of folks that have on these trips is that, what do? We do stuff that doesn't look very dramatic at the minute, but I think that when you look at the faces, I think that a little bit of caring, just a little bit of what every patient in the world wants is somebody to listen to them. And we come and we listen and try to do what we can. And
it's that old adage of time, touch, and compassion.
And we all walk on the same earth, But I found that people around the world, wherever I've been, we don't do anything dramatic, but the one thing that everybody wants is somebody to listen to them.
Yes, it's the last day of the clinic. We're expecting another full day, and as you can probably see out there, there's people clambering at the gates to get in. We've had a really good couple of days and some interesting observations. There were early reports yesterday that the biggest difference that we're making is that we're changing people's attitudes towards healthcare. The simple fact of us being here, of Westerners paying attention to their health, means that the Vietnamese are beginning to pay a bit more attention to their own health. So essentially it's about well-being and health education, which brings it around full circle to what I was saying on the first day of this tour. So we've got a good day lined up and busy clinic, so off I go. So there we had a young sibling couple, a brother and sister, who came in saying that they were affected by Agent Orange at birth. The brother had congenital blindness, as does the sister, but the brother unfortunately has completely disorganized eyes. He has no real formation to the eyes. He has a microphthalmia, which means small eyes, and he doesn't really have proper lens or cornea formation, so he doesn't have any hope for his vision. The girl, however, has congenital cataracts, and looking into her eyes, her retina and her optic nerve are healthy. So it means that if we do cataract surgery, we may well be able to treat the underlying condition and give her some vision back. It'll never be as good as the normal person's, but certainly we'll be able to let more light into her eye and increase her quality of life quite significantly. The problem is she doesn't have money to afford the operation, so between us we'll sort out something that so we can get her operated on in Hanoi to give her back her vision.
We have people waiting. It looks like hundreds waiting behind this gate.
We have a lot of people here just waiting in line, and then they're kind of bored, waiting for their turn to come in and register. And we have a poster demonstrating about toothbrushing, which is part of our campaign. So I'm just demonstrating about how to brush your teeth. And then we have quite a few toothbrushes, and we have some large family-sized toothpaste. So we're just taking the opportunity to get these into the hands of the moms who have the families. Everybody wants one. I think medical tends to be the priority, and then after that comes dental care. And so a lot of these kids have probably never seen a dentist and have very rudimentary understanding about dental hygiene. For us to be able to come and do this now and then train the teachers and leave some supplies behind so that they can follow up 6 months later will make a big impact on the decay of these kids' teeth and will help preserve them.
Dental hygiene is obviously not a very well mediated thing here. What the older people tend to do is, you may have seen that they've got black teeth, and they put this black material, I don't know what it is exactly, but it protects their teeth from decay. Now it may look cosmetically bad, but as long as it's keeping them with their own teeth, because otherwise I'd imagine that most people in their 60s, 70s or 80s would have absolutely no teeth. So yeah, we've come to the end of the clinics. It's a busy one. I think the number tally on my sheet of paper when I saw her, the last patient was something around 1,200 patients. So that's the number that we've got through in the last 3 days. So we've seen a good number of people, and I'm feeling really rather wholesome and contented. The staff here are so very kind, golden hearts, golden people. Everyone's worked very, very hard.
I think the impact will be several-fold. One, we do a lot of screening, we pick up on some problems, we do some preventative care, and we, I think, convey to the local people the importance of their own health care.
I think the people here in this village certainly appreciated us being here. We have enjoyed taking care of them, there's no doubt about it. It's a good experience for both sides.
And hopefully from this we'll inspire some of these youth that are running around to get educated and get medical training and come back to their communities and lift everyone's boat in that way.
It's an incredible industry. It's been really good going. Very impressed with the group. It's a humanitarian crowd doing humanitarian things. They're acting not out of any purpose of self-belief, but it's out of true altruism. It's humbling to see it. An amazing experience.